Hi, it's Bruce Robinson here from the Fathering Project, talking a bit about the medical aspects of COVID-19 for the dads and families who are at home for our Fathering channel. When you think about the COVID-19 pandemic, you can't help but think of China, of course, and then all the terrible situation in Europe, starting with Italy and now going to other countries. But when you think of the United States, which now has the most cases in the world, you think of New York City. And right in the middle of New York City is New York University and the hospitals there, right at the front line. And a close friend of mine, Dan STERMAN, is the head of the lung department, the pulmonary department there. So I thought it'd be fun just to talk to Dan, talk to him about what it's like at the front line, a bit like a war zone. And then what it was like for him, because he actually got COVID-19 himself. And then what about him and his family? So hi, it's Bruce Robinson here from the Fathering Project. And it's a great pleasure for me today to introduce an old friend of mine and a very close friend of mine in New York City, Dr. Dan STERMAN. And he's been at the forefront, the front line of the COVID-19 epidemic in New York City. And I won't say much more, but I'll invite Dan just to say who he is, what he does, and what his hospital has had to do.
Our main hospital is in Midtown Manhattan, and we have 3 hospitals up and down First Avenue, which is one of the main avenues in Manhattan. The main hospital is called Tisch Hospital, and we also have a venerable public hospital called Bellevue Hospital, which is the oldest public hospital in the United States, and a veterans hospital where veterans from the armed forces can go to obtain their care. Our doctors provide all the pulmonary and critical care and sleep medicine services at all those hospitals. And
can you tell us a bit about, Dan, what it's like, as a leader of the pulmonary division of your hospital, right there in the middle of Manhattan? What it's been like for your team to have to deal with COVID-19 cases? Because in Australia, we watched the New York City, the pandemic hitting New York City, and it looks terrible. So tell us what it's been like in your division.
Well, it's like nothing I've ever seen before in my life. I've been privileged never to have to live in a war zone, but my guess is that what we've been through in New York City in the last 4 to 6 weeks would probably be somewhat like that. And especially from a physician's perspective, a healthcare worker's perspective, the sense that you have to mobilize, that you have to act, but also potentially putting your life on the line, your own personal health on a day-to-day basis, is the closest I hope I ever feel to being in that kind of situation. We have at each of our hospitals intensive care units normally, as of say 3 months ago, that would have somewhere around 20 to 25 patients maximum per intensive care unit at each of the 6 hospitals that we run. And we went from a 20 patient intensive care unit at the beginning of March to within 2 weeks having to quadruple and quintuple and then go up by about 10 times that size, so that we had almost, at our main hospital, went to almost 200 patients who are critically ill from COVID-19 in one hospital alone. Across our entire 6 hospitals, over 1,500 critically ill patients, most of them intubated on mechanical ventilation. And in our hospitals across all of our health systems, somewhere between 3,000 and 4,000 patients who were admitted to the hospitals, many of whom did not require the intensive care units. So we did not have the doctors and the nurses and the respiratory therapists and the radiology technicians and the nursing assistants to care for this group of patients. We had to mobilize. We had to create intensive care units out of floors that were not destined to be intensive care units. And we literally had to mobilize doctors from all over the United States, nurses, respiratory therapists, to fly into New York City out of their own goodwill, altruistically, to come and risk their own lives to come help us out. We also asked every doctor from every discipline, whether you're an ophthalmologist or a radiologist or a dermatologist, to help us out in some way. some to work on the front lines, working with us in caring for the patients right at the bedside, some to make phone calls to the families, because the families are not allowed to visit their loved ones in the hospital, even the ones who are near the ends of their lives. And so the radiologists and the medical students paired up to provide information to the patient's family members and loved ones back home, because the doctors in the front lines were too busy to be able to call the families and give them the most pertinent information that was necessary. So I've never seen anything like this, the mobilization across all of our hospitals. We came very close on Easter Sunday to breaking. That was the peak for us in New York City, where we thought we wouldn't have ventilators for every patient, where we wouldn't have enough kidney dialysis for every patient, where we wouldn't have enough doctors or nurses, we wouldn't have medical equipment. But we somehow persevered through all the assistance of donors to the medical center, assistance from doctors and nurses all over the country, and from the people who live in New York City and the region through social distancing and adhering to the guidelines that the state and local and federal governments put in. The cases started to slowly go down. Our emergency rooms went from near chaos to control. And our ICUs, I was working in the intensive care unit today, and quiet and controlled. We still have 150 patients intubated in our main hospital, but these are patients who are in the chronic phases of their critical illness and no longer in the acute phase. And so we are more able to deal with them. We still rely on doctors and nurses from all across our medical center and across the United States to help us out. And we expect in the next couple of weeks that they'll need to go back to their homes and their jobs. And even here in our own medical center, the cardiologists and the gastroenterologists will need to return to their day jobs. And the critical care doctors, the pulmonologists, will persevere on the front lines. And we're doing okay. We worry about what happens if social distancing breaks down and another surge comes, because we don't know if we're going to be able to handle it nearly as well as we handled the first surge. And so we urge all of our citizens in New York City and the United States to try to hold fast, to adhere to what the government is saying, and keep yourself safe at home as much as possible.
And it's interesting when you drew the analogy with war, because you talked about volunteers coming. And this weekend in Australia happens to be Anzac weekend, where we honour the people who fought for Australia. You know, a lot of ceremonies, obviously not the same as every other year because of the social distancing rules, but it's a very, you know, deeply spiritual, if you like, day for Australians, as it is, I'm sure, for Americans and everyone else in the world, to honour those that have fought in the war. And I had this feeling, because I had already done my pulmonary service. I'd done quite a bit of service before the COVID-19 happened. So I was, if you like, at the back of the queue. But when we began to mobilise the team in anticipation, I felt like one of those young guys who saw his friends going off to war. I just couldn't say no. So, you know, I signed up to do extra duties for the pulmonary division, just because that feeling of not helping would have been terrible. And I say that because, you know, we do admire our colleagues like yourself who are really, I mean, it hasn't turned out to be, so far, the avalanche of cases that we were prepared for. But in New York City, we see it on the news. So, and I guess we have that, there's definitely in the community the same sense of gratitude towards healthcare workers, because everyone's aware that they're not just working hard, Dan, like you described, incredibly hard, but taking a risk. And I read in the Guardian newspaper from London that 100 healthcare workers in Britain have died of COVID-19. And you must worry for your staff as well, because you know, it's just, you know, as someone in the field, it's kind of impossible to totally protect yourself with all the PPE gear. So do you worry for your staff?
I worry for my staff every day. I still worry for myself. I'm a survivor myself of COVID-19. Very early on in March, I was on a service that I thought was relatively safe, and likely acquired the virus there. And harking back to what you just said, Bruce, it was very difficult for me because I had to quarantine myself right near the beginning of this process. And I did not leave my apartment, which is adjacent to the hospital, for 2 weeks at a time when everything was ramping up. And I wanted so much to contribute on the front lines. And the only good part about having this happen in 2020 as opposed to 1920 is that I have a laptop and a cell phone, and I was able to coordinate all the activities, including starting research clinical trials, coordinating research activities and clinical activities across all 6 of our hospitals without leaving my apartment. So that's the advantage that they didn't have during the Spanish influenza of 1918 yes. that we have now, is that we have technology so that you can maintain a contact. But still, you and I are used to being with patients and caring for patients. And I know that you had gone after the tsunami to Indonesia, and we're very hands-on there in caring for the survivors. I felt that same need so I could not wait until I was cleared and healthy enough to get back, if only to give a break to those who were truly taking the hardest jobs so that I could alleviate them for a weekend or a few days during the week, because I still have all these other responsibilities as the director of the division.
Dan, I know you've got a wife, Jermaine, in Philadelphia, and you've got the 3 kids, and must worry you too, like the impact, all sorts of impacts on kids. Tell us maybe about your family and your concerns for them and how it's impacted them.
Certainly. Well, I have a relatively unique situation in that 5 years ago, I took a job in New York City, which is about, as I said, 75 miles, an hour and a half train ride away from my home, which is in the suburbs of Philadelphia. And my wife is a physician, an ophthalmologist inside of Philadelphia or outside of Philadelphia. And we made the decision that the opportunity for me to come to New York City for this job was worth it, even though I was going to have a commuting relationship for a while. And so for the first 3 years, I spent Monday through Thursday in New York City and came back Thursday night and spent Thursday night, Friday, Saturday, Sunday in Philadelphia, worked from home on Fridays. And then the next 2 years, 5 days a week in New York City and 2 days in Philadelphia. So we're used to some distance, communicating during the week many times and spending quality time during the weekend. And my children were also used to me being away during the week, and it was during the busy times in their schooling, so that they had a chance to understand what it's like to have me home and not home. They've been at university for the last 2 years, my youngest 2, twins, and the older one set to graduate from university this May. So they're all have been away at home and are supposed to be at university, and yet the universities send all the students home. My 2 youngest are back in Philadelphia living in quarantine with my wife, not really quarantine, but stay safe at home. And my eldest is living outside of university in Atlanta, Georgia, in the south of the United States, with his friends from college in an apartment and taking online classes, as are the youngest ones. So we communicate by FaceTime and phone call and texts, and we have a group chat among everyone in the family, and we send each other jokes, news that's coming up. So I do worry about them significantly, but they're a fairly resourceful bunch. My wife's a physician, so I know she will look after at least the twins if they'll let her look after them. So, and I know that I'm not far away, so if I need to come home in an urgent matter, I can come home.
Well, we're grateful to Dan for sharing that with us, and certainly wish you all the best as you continue on this journey of isolation with the family. We wish you all the best as dads and mums and stepdads and other father figures during this time with the kids at home.